I try to make sure that when I clean my teeth with my brush, I also use the same brush to clean my tongue. But what I do is I try to wash off the toothpaste that I've been using on the same brush.
Yeah.
I rinse it off, put on a clean little bit, and then I do my tongue. Is it a waste of time? Can I just use that same thing to clean my tongue?
So, from what I understand, you're saying you're using the same toothbrush as you brush your teeth and then your tongue.
Just scrub the tongue.
Yeah. We also have special brushes that you can use to clean the surface of your tongue. So you can use those as well, or else you have a different range of toothbrushes that are modified to help you to get into different places, especially with aged care. That this one is very good, helps to get in surfaces to be able to brush appropriately. Did that answer your question?
Yeah, because I always say to my children, I always say you can brush your teeth and take the plaque and all that out, but it's the tongue. Still gonna clean the tongue.
Yeah.
Yeah, and we use the same brush to do it. That's why I'm just asking, is it hygienic to use the same brush? So you're in the mouth cleaning, you've got all the plaque on the brush. Is it hygienic to use the same brush to do the tongue or wash?
Yeah, it is.
Or is there a special brush for that?
See, I really like that you're teaching your kids that, because most people don't brush their tongue. And so it's a really good thing. The purpose is to remove plaque and remove the bacteria from the mouth. And so within one application, yes, you can still do that.
There are even these brushes.
Yeah.
Again, can I just butt in again? They do make things called tongue scrapers. So you can get those that you can use rather than using a brush if you're concerned about the contamination on there. You can use the plastic tongue scrapers that you can use and just run across the back of the tongue and clean things
And you just
up as well.
dump it in a
So it's not
small
necessary to
bottle?
use the brush.
And there's also the back side of the toothbrush that has threads on it just to help remove that.
We would encourage you all to move forward to have a look at the products because that's very happy for you to do that. We allow time for that so you can actually handle the products.
Yeah. And while I'm here, so we recommend using an oscillating electronic toothbrush. So that's when it rotates. So this will help clean the surface. Normal toothbrushes are okay.
They're better, are they?
They help with plaque removal. But remember, just remember that you use light pressure. You're not like when you're going to the dentist. Usually, you brush really hard because I don't want the dentist to see my teeth. It's light pressure. It's not rough pressure. One thing that's really good about electronic toothbrushes is I talked about 2 minutes. A lot of toothbrushes nowadays, they have a 2-minute period, or they have phases that within 30 seconds they vibrate a little bit different to help you to go to a different area in your mouth. So that helps to let your toothbrush kind of help you with the time of brushing your teeth.
Yes. And what about cleaning under a bridge? You have a tooth with a bridge. What's the proper way to clean underneath the bridge? Because I use like a piece of dental floss that can go through, but there's like a gap.
Well, it's interesting that you mentioned this actually. There is a special product that you can procure to help out with the cleaning of bridges, and it is known as super floss. So it's a special piece of floss that actually has a kind of fluffy, fuzzy, wider area surface, so that when you would put it underneath the bridge, it kind of expands, and it makes cleaning so much easier than to just go with a regular piece of floss, because otherwise it's just a tedious process, and this will make it so much easier.
Where is that available? It's like I'm not seeing it other than just the floss. Is it in the shops?
Super floss is available in
Could be available in different like
Pharmacy.
a pharmacy.
A pharmacy.
A pharmacy, I would say would probably
Super
be the best.
floss.
Super floss.
Yeah.
Can't go wrong with that.
Just also one thing we wanted to mention, dentures. Dentures are sort of, well, they are tailored to fit everyone individually. So you can think of it as a suit. So it's obviously not recommended that dentures be shared or anything like that because it won't fit that other person. It's like it's a tailored suit, like it's tailored for that person.
It's not one size fits all.
Yeah.
denture brush and ordinary brush as well. It's good to keep it dry, and also maybe once a week you can disinfect this one. Normal toothbrush you can soak in the mouthwash that kills like a 99.9% bacteria. 30 minutes, an hour, that's all, and then dry, rinse and dry. And then this denture brush as well. Denture brush, you don't need to soak in the mouthwash. However, you can use a 1-to-1 ratio of the bleach and water, and then just soak in maybe 10 minutes, and then you can rinse it off very thoroughly, okay? Don't leave it any residual of the bleach, okay? You can do that. And I just didn't mention this with the metal one, you should not use vinegar or bleach, okay? Because this is gonna be deform the metal, okay? So you shouldn't use. That's all. That's why it's better to use this tablet. So you can use even like just a full acrylic or any metals there. You can use it. It's very safe. Other questions? Yeah.
Just for the group, so how much does it cost to get a denture?
Denture, it's the price is quite variety. If your patient actually come to the JCU dental clinic, because students actually make a denture for the elderly, and if we made ourselves, because we learned how to do the prosthodontic the lab work, so it's free, but generally it doesn't work that way, okay? So if you go to see a dentist, it costs like over $1,500 to go over $3,000.
Okay.
Particularly this chrome cover, it fits very well and very thin. It's very thin metal. This one is acrylic. It's very bulky. Okay, because if it's made very thin, it just break. Okay, so we have to have a certain width of the certain thickness of the material. But this one has to be made in a professionalized, and it's quite expensive. This one can be the most expensive one, the chrome cobalt one.
Because the lab has to make it.
Yeah, lab
Yeah.
has to make.
It's just going to be that much.
And how long does a denture last?
Oh, some of my patients actually, I thought she used nearly 50 years for one.
But is that okay?
As long as it fits, but however, when you don't have the tooth in the jaw, then bone is actually recessed. So the shape's gonna change. So meaning is you're gonna have a loose denture. So it's the beginning of the stage of the loose denture. As I told you earlier, you can use adhesive to prevent the falling off. However, you should make a new one. It lasts usually 15 to 20 years if you well maintain.
Yeah.
And
Okay.
It's very multifactorial.
Yes,
A lot of
yes.
things that can tie into how.
Yeah.
A lot
how
of
long a denture
factors,
lasts.
and there's a lot of solutions as well. So in a sense, you can ultimately probably have the denture for a couple of decades if you take good care of it.
Yeah.
But as Hanju mentioned, eventually the bone around your teeth, if there's nothing there, it shrinks a little bit, and a little bit. So what solutions do you have in this case? Well, again, you can use one of the products that we demonstrated, or you can go to the dentist, and then there's a couple of more options there where you can get the denture relined, which is where there's a little bit of repair happens, which makes the fitting surface a little more comfortable, and then it works once again. Or ultimately, if it's gotten to the point where it's too severe, then that would be the time where you would consider upgrading to a new denture.
Sorry, I had a question from the audience. How long does it actually take to make the metal dentures compared to the pink ones?
Usually they need because when you make a denture, there's a couple.
Sorry, my mistake. Oh, which one lasts longer? Sorry.
Oh, it's
Which one lasts longer?
It's all quite similar. Depends on how your bone is recessed, and then you change your. Yeah. Oh, sorry. So mouth conditions. Yeah.
Depends upon the health of
Yeah.
the mouth.
Yeah, the health of the mouth and just
And-
general care.
It's fully depends on.
So, is it on both sides? So both sides, different size teeth. They can fit it to make it match like new teeth, or it's all different for different people, isn't it?
Yeah, they have three different shapes and then shape of teeth, and then they have different sizes as well, and the colors as well. We call it shade, but there's a different colors. So we're gonna check if you have any tooth left, then we're gonna check what color of your tooth, and then we're gonna matching. So
Because I thought the metal ones would last longer than the plastic.
Not necessarily.
not necessarily. It's just strong, but it's not necessarily lasting.
It's
long.
stronger in the
Yeah.
sense that it's
Yeah.
more resilient, yes. However, that rate of your bone decreasing over time isn't going to change. So, yeah, I mean, if you're taking care of your denture, both should last a while. But let's say that if you drop one, there's a bigger chance maybe the acrylic will just break into two pieces. But, however, the chance of you needing to replace it later on because of bone loss is the same.
Sorry, Sue? How does food affect it? Does it matter what you eat with them, with each of them?
Well, you sometimes I think, you know, because nothing is going to be as strong as the original teeth. So if you can get the denture to lock into place nicely, the better the fit, the more you'll be able to eat. But generally, what will tend to happen is you'll cut the food into little cubes, and you'll chew at the same time on both sides to sort of counteract that.
If you're eating something very sticky, the denture can dislodge. So if you're eating caramel or something that's really sticks to the teeth, it can pull the denture down.
Also, a lot of these students will potentially go out and work in community. So just for their benefit, as an advocate for their clients, your service at JCU, what sort of waiting period is there? Who's entitled to go there? Does the pension card or, what's the
Yeah, the
healthcare card.
Healthcare cards are more than
Yes,
acceptable.
Concession
the
cards.
healthcare card allows them to get the denture for free in third year because we're the ones making it, so that allows them to get it for free in the third year. Fourth year students can do it, and they send it off to a lab, but that one is associated with a cost. So the thing is, and it depends sort of like when a third year makes it, it will probably take around the semester, whereas with a fourth year, because they're sending it off externally to a lab, the turnaround time is a lot more rapid.
And so the waiting period to get into C?
It's about a year to a year and a half.
Is it?
So it
Yeah,
is
we're
a
very
really
booked in,
long list.
unfortunately.
Wow.
So if
Yeah.
to recommend your patients to come and see us as soon as possible for an
That's
assessment.
just for dentures, it's not a year.
Yeah.
Yeah.
Yeah, just for
Oh,
dentures.
okay.
Yeah.
Okay. So
For,
just a general
dental
oral.
treatment, no. That varies, the wait period varies depending on the time of the semester.
Yeah.
And it can be as short as 2 weeks. But if it's at the end of the semester when you're trying to make an appointment, you might have to wait up to 3 months until the students start up again in February.
Yeah. And you have full disability access
We
to
do.
your service?
We do.
Yeah.
We have
great.
ramp access to the dental clinic.
Great.
We have wheelchair available, and we have parking obviously at the front of the building for anybody that's disabled, and security will also assist with getting the patients in sometimes.
Great.
Has anybody here attended JCU Dental? Perfect.
Yeah,
Very
definitely
good.
worth keeping in mind, guys, for your clients when you're going out there. And do you do, oh, sorry.
No, you're sorry.
Oh,
You have to remember the denture appointment, we required at least 6 to 7 appointments to get it done. And then we usually have like 2 weeks interval between the appointments. So it's taking
Yeah.
nearly like more than
It's
two-
not a one
2
sitting
weeks.
thing, it's a little bit of a commitment to get the full denture set up.
is that the same for a normal dentist?
Yeah.
Yeah.
Because we have 3 technicians, 2 prosthetists, and 1 dental technician at the JCU. So we actually make a denture. However, we get marked and confirmed when they said, when they proved, then we can deliver. Each step we have to get proved. So we deliver nearly same quality as you making in a private
but it might be quicker at a private
Oh, I
practice.
guess it would
all
be
are
much
quicker.
quicker.
Yeah,
So
much
what,
quicker.
because for some, your clients will lose their denture, it might go into